Hi, everybody.
Morning, Hannah.
Good morning.
You should have the host role now, and I've started the recording for you.
Yes, I see that. Thank you. Okay, I see 2 call-in users, but I cannot tell if they should be panelists or not. I'm going to unmute people who have called in. And if you're someone who's on the committee who I should make a panelist, let me know.
Hi, Hannah. It's Shelley.
Hi, Shelley. Did you call in?
I did. I don't have camera access through work.
What's your phone number, just so I can make sure it's set up correctly? Does it start with a
500 3391?
Okay. Got it. I'll keep you unmuted then.
Hey, Hannah, this is Lamoris from Urban Housing. Can you hear me?
I can, Lamoris. Hello.
Hey, okay. I called in also. I'm in the office and we don't have our microphone in the computer hooked up. But I can see you on camera also.
Great. Then I will keep you unmuted as well. All right, we're going to give people a few more minutes to join because a few people should be joining. And it took me a long time to get on, so it might take everyone.
Good morning, everybody.
Good morning, Lisa.
Get some headphones on so I can hear better. So the part where guess not. Okay. Hi, guys.
Hello. All right, I'm about to send out the text of the motion that someone's going to need to make to start the meeting, that we're allowed to have a virtual meeting, that I have not sent out yet. So I'm going to email that to everyone and then someone can do it.
Hey, Hannah, I'm going to go ahead and drop off, but you have my email. If you need help with anything, just let me know.
All right, great. Thank you so much.
No problem.
Okay. Welcome, everyone. I think we can probably get started. I did just send out that motion. Thank you, everyone, for being patient on the video invite. because we potentially have we do have two members of the planning council on this committee, in Catherine and Michelle. These meetings have to be recorded as well as public. So that means Metro IT has to set them up instead of me, and that takes a little longer. But we're all good.
I'll move to make a motion to start the meeting.
Great. And then we just need someone to make that motion I just sent out about how this is essential business. That means we can have an electronic meeting.
Can you hear me okay? Can you hear me? Can you guys hear me?
A little quiet, but we can hear you.
If I talk louder, is that better?
Yes.
Okay, I'm going to pop over and read the motion because I did not memorize it. So
Yes.
I move that the items on the meeting agenda constitute essential business of this committee. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak, and any rule conflicting with the governor's executive order permitting electronic meetings be suspended.
All right, great. Then I think we just need a quick
I'll second.
vote. Second, great. And then I think we need to vote on it. So,
Okay, all in favor?
yeah.
Say aye.
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 All opposed?
Great. Thank you, everyone.
Motion passes.
All right, welcome. Hello. It's been a while since we had a meeting, like 8 months or something.
Wow. Time flies.
I thought we could just start with, since some people may not know each other, some introductions. And I think since, we haven't had a meeting since the pandemic started, it might be helpful if everyone gave a little rundown sort of what they're doing looks like right now in the pandemic, all of our programs. I think it might be helpful for us all to know that about each other if we don't already.
You want me to start, Hannah?
Sure.
Can you guys hear me okay? I'm trying to lean in and talk loud. I'm Lisa Stetter. I'm the executive director of Crossroads Campus. And we've had an interesting year in that we were hit pretty hard by the tornado. And then, of course, the second punch was COVID, as all of you have experienced. All of our programs are up and running pretty much as normal at this point, and we hope to be able to maintain that if COVID levels stay where they are in Nashville. We are submitting some of you know that we have a pretty significant expansion project underway where we'll be building a new campus over on Buchanan Street, and we're submitting drawings for permit review this week and expect to be under construction by February. So that'll create 22 additional beds of housing for our young adult population, and it will also probably create another 20 to 30 job training / transitional employment opportunities for our young people as it develops over the next few years. And that's all my news. Who wants to go next?
Go next. This is Kathy Simbach. I am the court administrator of the Davidson County Juvenile Court. I work for Judge Sheila Calloway, and my colleague Shelley Hudson is also on this call with me. She'll introduce herself as well. We are at juvenile court. We had some problems with some small COVID outbreaks. We didn't have anything that constituted a cluster under the health department standards, but we've had some little, I call them mini clusters, at work, including myself, Judge Calloway, another judge, and then several of our staff members. And so we had to go to part-time or just emergency hearings only in the courthouse for a little while. The judge had to ask permission from the Tennessee Supreme Court to cut down our hearings. But we are now back to our regular COVID normal. We are working right now on trying to move our planning process for our new building forward. And our new building will include respite beds for kids who are not detainable, youth under 18 who are not detainable, but who don't need to go directly home because of conflict in their homes or some reason that they're not safe to be at home. And so Judge Callaway and Lonell Matthews have started meeting with the members of the council to try to get that project prioritized. It's already in the capital improvements budget, but we're trying to move the funding forward, at least with the planning phase, the architectural planning and design. So thank you. It's great to be here.
Thanks, Kathy. Awesome that both updates so far are like, there's going to be new beds for people.
I'm Shelley Hudson. I am Judge's Special Projects Program Manager, and I also work with teams at Juvenile Court to develop operations manuals and policy, and any other opportunities that Judge gives me on projects. Happy to be here.
Shelley?
Hey, this is Michelle. Sorry. Someone else going.
Michelle, I'm going to call on you.
Sorry. Were we waiting for you to call on us, or were we just popcorning?
We're just popcorning, but now I'm going to call on you.
Okay, perfect. Yay. Hey, it's good to see people's names and faces. It has been a while. I'm Michelle from Oasis Center, and we are up and running and COVID beleaguered. So what we're doing right now is we're trying to do everything in ways that is as safe as possible in a pandemic. So we have limited street canvassing, and we're sort of overwhelmed right now with safety planning, basic needs, and housing navigation, case management. So our outreach case managers are in the building on site, and we have focused on connecting youth through phones, telephones, Zoom stations if they come in. We're not doing a lot of group programming at our outreach center, but we are there for emergencies and safety planning, and they can still connect to food and survival supplies, hygiene, clothing. And our street psychiatry program is still running out of the outreach center. The youth just come to a Zoom station. So that's kind of our mode of operation right now, is we're just trying to do everything in this very strange world of COVID. But yeah.
Who's next?
I can go next. I'm Ty Brown with the Nashville Launchpad. This is my boss, Trinity. And we have about 20 youth right now in a motel out by the airport. And we got 2 or 3 more rooms that are supposed to be coming our way. There's been a lot of difficulties kind of getting our full complement of rooms, but that's what we're doing right now. Unfortunately, we have a waiting list. It's pretty long. So we're just doing the best we can to take people as we get rooms opening up. And then hopefully some of these folks in the upcoming weeks and months will start getting more permanent housing, and then we can replace them with new folks. So we should have a complement of about 20 rooms pretty much the entire time through at least March 31st. And as long as funding holds out, we're pretty close to fully funded for this. And that's it. It's a great program for them. It's really upgrade for the folks who get to stay with us, because instead of sleeping on a floor on a mattress, they have a place for their own stuff. They have a place for their own stuff, place to sleep every night. They don't have to leave at 7 o'clock in the morning. A bunch of our folks are working, at least half, probably more than half. So a lot of people are going off to work, coming back. It's not a great bus line where we are, and I'm not real happy with the motel. So I have a backup motel, but I've got a ongoing dialogue with the district manager at this point to try to improve some of the situation we've got there. But either way, we're going to have about 20 rooms going throughout the cold weather season. Unfortunately, we don't have a way to participate too well in the emergency cold weather plan, which normally we would just lift our cap and just take whoever comes, even if they came, very late in the evening. And I'm a little worried about that. The weather's going to get colder here at the beginning of next week, so that's unfortunate. But the other unfortunate thing is we have a limit to how many people we can take. Instead of just whoever needs us any given night, we've got 20 rooms, and when they're full, we can't really take anybody else. So, but for those who are there, it's a great experience. We got dinners coming every night from either volunteers or restaurants, and Oasis is helping with people getting groceries directly to their door. And then, of course, Oasis is also helping with the rapid rehousing part of it. And I don't know this, but I'm really, really hoping that the idea that people are in a safe, not a shelter environment, really sort of alternative housing environment is going to make better outcomes for rapid rehousing, going to make people easier to contact. It's going to allow them to work on other issues other than just where am I going to stay warm today. So we're really excited about it. I guess that's it.
Yay, thank you, Ty. I would love to go last if someone else could go. Lamoris?
Yes, this is Lamoris Franklin from Urban Housing Solutions. What we've been doing with the pandemic is mainly trying to streamline our application process. I know that you guys already know that FISC Court is mainly for the youth, and over the last couple of months, we have attempted to go ahead and get some of the longer term tenants moved out so we can make that property all youth. I think we may have one person that is still there, but once that person has relocated, then all 19 of the apartments there at FISC will be for the youth. As I mentioned, our application process is a little more streamlined or modified to be a little easier to navigate with COVID. And we are, of course, working through the coordinated entry for that application process. That's what we're doing for the youth over the last couple of months.
Thanks, Lamoris. If people remember, Brent from Urban Housing Solutions used to be on the committee, but he's not going to be able to participate anymore. But Lamoris has been sent our way, which is great. How about you, Melody?
Hello, you guys. I'm back.
Hi, Melody.
I'm happy to be back with you guys. I'm a member with the Youth Action Board for 3 years, and I'm a member of the Youth Leadership Team also for almost 2 years now, and I'm happy to be involved. We've been with Hannah. We've been recruiting new people on the team. You're gonna be seeing new faces for 2021, and also with my other program, Youth Leadership. We've been recruiting new staff. I know if you guys have known Rod, Rebecca, there's going to be a new person named Megan who's going to be our new coordinator. Going to be this new year is going to be new plans, new challenges, and new faces, and I'm happy to be part of it, and I'm happy to see you guys again, and hopefully we can see each other face to face.
Thanks, Melody.
Melody, welcome back. I'm going to ask you a quick question. You
Yes.
Oh, Lisa, you're on mute.
again.
Huh?
There, I had hit unmute. I just wasn't successful. Sorry. So the I'm familiar with obviously the youth action board, but what about the youth leadership team? What's that about?
The youth leadership team, we do like, oh Lord, we do like a lot of stuff as like helping what was it? Oh my gosh, I need help here.
What office is that through? Who are you working with?
I think with the hub.
So it's related to the hubs that are at Martha O'Brien Center in Monroe Harding, and it's through the Metro Action Commission, formerly was with the Career Advancement Center.
Thank you. Thanks, that helps. You mentioned a name that made me think it might be hub related. Thanks, Melody.
Sorry, Lisa, I did not do it.
All right. Catherine?
Hey, this is Catherine with the HERO program at Metro Schools. And as most of you know, elementary kids have been back since after fall break, so about the middle of October. There's a chance that may change tomorrow. In our office, we're still doing kind of the same old and giving out clothing and food and supplies. I think our biggest concern is just the real decline in the number of students that we're identifying. I think that has a lot to do with kids not being in person, not seeing school staff, not seeing teachers. And then we've just had a real challenge connecting with our families with old phone numbers and just not being able to locate them. So that is very concerning to us. But for now, we are still our mighty little team of 3, and we're serving right now about 1,500 students.
Right. Am I missing anyone? I guess, Carrie, you should introduce yourself, even though you're not a committee member.
Sure. Hi, everyone. I'm Carrie Gornick. I am a guest today. Thank you all for having me. I'm here to talk about the Oasis Rapid Rehousing Program and what we have done over the last year and what we're doing moving forward. So I guess I'll save that for the presentation.
All right, Susie, you want to say anything?
Yeah, I'm Susie Tolmie. I work at MDHA, the housing agency, and I'm the homeless coordinator there. Typically, I'm busy, I would say a good 4 or 5 months of the year working on the Continuum of Care NOFA, or the Notice of Funding Availability, to renew and develop new projects under the HUD Continuum of Care funds. They have not, the NOFA has not dropped this year, and who knows if it will. We're hoping that it will be simplified to just renewing the current projects without the very in-depth, arduous competition that is usually surrounding the whole thing. But that has to be approved by Congress. And my understanding is that language allowing that simplicity is couched in a few of the bills before Congress that might or might not be voted on in December. So sort of a wait and see. So in contrast to many of you all who I am humbled by in terms of your adaptability and bending over backwards to try and kind of counter this awful disease and serve folks in the environment, I am a fly on the wall with a lot of exciting projects. The rapid rehousing money is $10 million this year versus around 450,000. So folks at our agency are working really hard on getting that money out to the streets, and Launchpad and a few other projects are the recipients of that funding for the first time, so that's exciting. The point in time count is going to be going on, not per usual, but it will be going on. It will be both a shelter count and an unsheltered count. The unsheltered count being substantially modified by that point in time count committee so that people are distancing from one another on the teams and distancing also from the homeless folks who are sleeping outside. But I do want to kind of put that on the table for the youth providers so that I think that Ty and Michelle are kind of looped in on the meeting announcements. But I just want to make sure that the youth outside are canvassed somehow, and there may be some outreach workers at Oasis Center that we could kind of tap to sort of help us locate those folks. But the idea is to count as many people outside as we can. We always miss folks, but we want to make sure that we do count those youth and young adults in the areas that they tend to kind of hibernate in. So let's see if we can work together on that. And then the stipends that have been supporting some of the hours of the youth and young adult volunteers on the YAB and some other efforts are going to continue. They're just sort of flipped from the YHDP planning grant funds, which ended at the end of September, and they'll be paid for under the Continuum of Care planning grant that MDHA has that pays my salary and some other related costs. So those folks will continue to be remunerated like the rest of us are in these meetings, which makes total sense to me. And if you got any questions about the point in time count or want to be added to that email list, I'll be glad to add you to that list where the group is meeting now more frequently than ever, probably about every 2 or 3 weeks to get things in line for January 21st, which is a Thursday night, I think.
Great. Then I'll go. So I'm Hannah. I used to be the YHDP project coordinator, but I am now on the coordinated entry team. But youth-related things still fall under my purview because there's not a different person doing the youth job. I just have a new job. And the other update I wanted to give was just how Susie mentioned, in case people don't know, from the CARES Act, our community received $10 million in emergency solutions grant federal money, most of which is going to rapid rehousing. Some of it is funding things like Launchpad got some funding and some street outreach, but a lot of it, millions of dollars, are going to rapid rehousing, specifically focused on individuals, which in our community just means adults who don't have children in their household. So it could mean adult couples, etc. And youth and young adults who are individuals are still eligible for those rapid rehousing programs, as well as the youth and young adult rapid rehousing program. So a lot of agencies are starting rapid rehousing programs that have never had it before, and there's going to be a lot more opportunities for people to get housing, which is very exciting, especially because we've never had rapid rehousing for regular, just individuals in the community before. It's just mostly been families and then YHDP. So those new agencies that have it are the Contributor, the Salvation Army has more focused on individuals, Community Care Fellowship, also known as Ken and Carol's, the Nashville Downtown Partnership, Nashville Cares, and Step Up on Second, which is a new to Nashville organization. And all of those referrals go through coordinated entry.
Hang on, I'm unmuted. I've got a question. What kind of housing can the rapid rehousing dollars be used for? Is it permanent or permanent and transitional? What does that look like?
So it's supposed to be for permanent housing, which means you have to have a 12-month lease that's able to be renewed. There's also a coordinated effort going on in the community to recruit and find landlords, because this is about to be like 400 people that can get this assistance. So we need a lot more housing units and landlords who are willing to rent to rapid rehousing, which, as Carrie might tell us later, is very difficult. And there is also a process underway to make an agreement with a hotel to utilize some hotel rooms and lease them for 12 months as apartments for some people who might be interested in that, who get in rapid rehousing, with a particular focus on people who may have a harder time finding landlords who are willing to rent to them. So a hotel might be an easier option for them.
So the hotel is eligible as long as they can do a 12-month lease?
Yes, and then there's like, you know, a habitability standards checklist that any unit needs to pass.
I want to reiterate what Hannah said it though, and the money that helps with the housing is for rental assistance that lasts no longer than 12 months. Usually it's 24 months in the regular rapid rehousing program. So it's a kind of a truncated period of time. And after that 12 months, these folks have to be able to float on their own somehow in terms of paying rent. So that's just something to keep in mind. And it doesn't include buying housing or, the units don't come along with it. So it's really, really important if you guys have landlord connections, or if you don't, to begin to develop those, because the subsidies that, need to move into some place to use the subsidy. And after the 12 months, they need to be able to, gradually sort of through the 12-month period, either get weaned off of it or find a permanent housing subsidy. And those are a little hard to come by. So it's a really exciting, there's lots of potential, but there are a number of little big obstacles that we'll have to overcome in terms of finding those units and then getting to the end of the assistance and figuring out how the affordability works after 12 months.
Okay, well, cool. Then we have Carrie here to tell us about Oasis NRYHDP Rapid Rehousing that has existed for a whole year now, which is kind of crazy and very exciting. And Carrie, I think I can pass you my hosting ability.
Great, thank you. Yes, it says that I have it now.
Great.
Good morning, everybody. So again, I'm Carrie Gornick. I am the director of the Rapid Rehousing Program at Oasis Center, and we have been, we launched in October of last year, and we spent about a month developing the program, and we took our first referral in November of last year. So we have been working with our young people to find permanent housing for a year now. We've had some great successes, and we've had a lot of challenges. It's a challenge in itself to quickly start up a program, and it was compounded by tornadoes and COVID. So it's been quite the year, but I would say in spite of all of its challenges, it's been a successful year, and we've learned a lot and are headed into a successful year too. I have a PowerPoint I'm going to try and share here. It's brief. So let's see. Can you all see that?
Yes.
Awesome. Okay. So I know that many of you were involved in the planning process for bringing YHDP to Nashville. So just wanted to include this as a reminder that our community needed to go from, we had a lot of prevention response and we had a lot of emergency response, and our housing and supports were lacking. And thanks to ESG, as Hannah mentioned, they are growing. But we wanted to move from this to this, and rapid rehousing helped bring a large portion of housing and supports. I know we still have a ways to go, but it was a step in the right direction. So about our rapid rehousing program, for those who don't know, our annual budget is a little over $1 million. And we work with 70 young people to support 70 young people in housing a year. We just recently added on additional case managers. We were able to leverage some of the ESG funding so that we could work to serve 70 young people a year. The intensity of need of our young people was more than expected. And of course, the case management style has been compounded by COVID. So we are operating mostly from home. And so a lot of everything is done virtual at this point. We have in year one, we had a 6-month rental assistance step down plan. And what that looked like was we had 2 months of full rent that we paid on behalf of the young person. And that included a security deposit, application fees, any prorated rent in addition. And then we had 2 months where the young person would pay 1/3, and then 2 months where they paid 2/3, and then they were expected to pay their full rent at that point. There was the allowance for what we call exceptions, where if they needed additional assistance for rent, we would talk about, they would work with their case manager to talk about why that is, what the plan was to overcome whatever barrier to paying rent, and we would look at approving that extension. So what we found in year one is there was a lot of extension requests, a lot. 2 months of full rent was not enough. But we also weren't sure how much rent would cost. Would everybody need a double security deposit, first and last month's rent up front? So we had to budget based on a lot of unknowns. So we have transitioned in year two already to a 9-month rental assistance step-down plan, where we are able to provide 5 months of full rent for our young people while we work to connect them, which I'll talk a little bit more about, to the wraparound services so that they're able to stabilize and pay their own rent. So we do 5 months full rent moving forward now. Then we do 2 months of 2/3 rent and 2 months of 1/3 rent, excuse me. And then after 9 months, the goal is that they would be paying on their own their rent. So we work, once they're enrolled in the program, the team hits the ground running to connect them to permanent housing. We have several landlord partners who have removed some barriers to housing for us. They are willing to accept employment letter that a job offer has been made without actually having any income yet. We have some landlords who are somewhat lenient on background. We have some landlords who are lenient on who is on the lease, because we know a lot of our young people want to live with others, but not necessarily put them on the lease. So they will allow them to list them as an occupant so that they can be there safely, but not legally be on the lease. So nobody is tied together. And that actually has worked out well because we have an age limit, 18 to 24, and some of our young people have partners who are over 24 years old, and we cannot put them on the lease in the program. So we've worked very quickly to connect them to permanent housing. Right now, we're averaging, I think it's 49 days from enrollment to housing. I have that on another slide, which is why I think, but I'm pretty sure it's 49 days. So that's really quick. Our goal is 30 days, but in year one and amid a pandemic, 49 days is very quick with the barriers that our young people face to housing. So after we connect them to housing, we work to connect them to wraparound support. So where they're going to get income from, whether it's employment or another source of income. A lot of life skills training, how to maintain your apartment, cooking, cleaning, paying rent is a life skill. How do you pay your rent? How do you talk with your landlord when you need to have, maintenance issue or negotiate that you're going to be late on rent? How do you communicate that? So we do a lot of life skills lessons. We also work to connect with health services and mental health, education if they're interested. I will be honest, a lot of our young people, due to their level of crises, they're looking for income and they're looking for income now, and education is a far off idea for them. But it is something we engage in conversation around. It's to provide them with the resources and connections if it's something that they want to do now or if it's something they just want to have for when they're ready. Lots of food, lots of grocery deliveries. So it runs the gamut of wraparound services based on really what the young person needs. We do have the ability to help with childcare while they're working to get connected to a childcare subsidy, and we have done that on a rare occasion. We have a lot of young people who have children. Luckily, many do seem to have family who is able to help support with the children. Our rental assistance is scattered site. We do not have one building where we house young people in. It is all throughout Nashville. We have several young people who have wanted to move to Clarksville. It's cheaper, and there's some good employment opportunities out there. We have some young people who want to move to Clarksville for safety reasons, want to leave the Nashville area. So we have landlords both in Nashville, Lebanon, and Clarksville at this point. So in the last year, we served 65 youth households. That was from year 1 to really November 1 through the end of September. 65 youth households, which was a total of 86 persons enrolled. Of the 86 persons, 52% are Black, 30% are white, 13% identified as biracial or multiracial, and 5% chose not to identify. Ooh, I did not know I could do that. Sorry, y'all. There we go. 52% identified as female, 43% male, and 5% identified as trans female. Some other interesting statistics from year 1, 35% of our young people enrolled were experiencing chronic homelessness at the time of enrollment. 73% of our young people enrolled in year 1 had a history of domestic violence. That doesn't mean they came through the domestic violence DVCE. In fact, the majority did not, but 73% had a history of domestic violence. 41% were staying in emergency shelter at the time of enrollment, and 41% were living in a place not meant for human habitation. So outside their car, a shed, different places outside. 35% when they entered the program had some form of income, and 38% when they entered had some form of health insurance. And in year 1, our housing outcomes, we housed 43 households in year 1 for a total of 64 people. And since October, since we started year 2, we have housed 9 households for a total of 15 people. And in year 2, we have increased. I mentioned we've hired 2 new case managers that just started in the last couple weeks. So we are going to be able to increase the capacity of young people we serve by about 20 to 30 young people a year, which is really exciting. So more young people being connected to housing. I do not have recidivism rates yet. I feel like that's probably going to be a question because we just wrapped up year 1. Our young people, while we housed 43 households in year 1, that's been since November. So a large majority were just housed this spring. A large majority are still enrolled in our program. So we don't quite yet have recidivism rates to look at and analyze about how the program has done. And how to access rapid rehousing. So rapid rehousing we do not take direct referrals. We take our referrals through the coordinated entry process. So in order to access rapid rehousing, you need to be entered into coordinated entry. So this is how any young person in any of these situations below accesses crisis services at OASIS. And our crisis team that Michelle spoke of can help them connect to coordinated entry in order to gain access to our rapid rehousing program, as well as the growing number of rapid rehousing programs in the city. And this is our team. I thought I'd include a slide of the team. This was our very first COVID Zoom meeting. So not pictured are our newest case managers, Cabrina and Shalia. But we do have a great, very hardworking team. They are constantly running to meet the needs of our young people. And they're just awesome. They amaze me every day with the way they support our young people in housing. And that is my very brief presentation, but I wanted to save time for some questions, if any.
Hey, Carrie, I was just curious to see how many of the youth actually were not on their own, because when you're talking about like 43 households and that translates to 64 individuals, you mentioned a number of them had children, so it could be a child, but it could be a partner of theirs, I suppose. And then of the 9 house since the new year started, then there were 16 individuals there. I guess I just figured more of them would be alone, but it's sort of interesting how many of them are accompanied somehow.
Yeah, and I don't have a breakdown of that. I can certainly get it to you all if you would like. But a large majority of our young people either have a partner. I would say a large majority have a partner versus children. We do have several with children, but it's more the partner. And that is accounting for the partners that we can enroll. That doesn't account for our young people whose partners are over the age of 24, which is quite a few as well. And I think that speaks to having worked outside of the youth arena as well. I think that speaks to the socialness of our young people. They are very social. They're very connected in the community with other young people experiencing homelessness. And so they tend to come together, and when they don't technically enroll them, we often find they're still staying with them. And try to, again, work on having them added as an occupant if they don't want to enroll them as a family member.
This is basically a statistics question and you didn't put it in there, so you're not going to know off the top of your head. But you guys are collecting if any of them have been a part of the child welfare system or in juvenile detention previously, right?
Yes, we are collecting that. And this morning I thought of the fact that I did not include some of that on there. But some of it's in our APR report in HMIS and some of it we're collecting separately, but that is something that we do collect. I can definitely work to get that breakdown from year one for everyone.
I would be interested.
After Thanksgiving, Hannah, I promise.
Hey, Carrie, this is Lisa. It sounded like that you were able to utilize some of the emergency cares funding to bolster case management.
Yes.
And it sounds like the needs were greater for case management for this population than maybe could have been anticipated. What does it look like in years to come as a need to continue to have that level of case management, but presuming that that additional funding won't be around?
Absolutely. So we were able to strategically having a 2-year grant. So a 2-year grant looks a little bit differently than a 1-year grant in that, the money from that wasn't spent year one rolls over to year two. So we were able to move some monies around that we could, strategically utilize the ESG money to pay for a staff member so that we didn't have to change a lot of the program dynamics and determine who was enrolled in which rapid rehousing program, because they do look a little bit different. So we do have the monies to maintain an additional staff member once the ESG money goes away, if as long as things remain the same. So that was a long answer to yes, we plan to be able to maintain that.
Yeah, that's a good answer. Thank you.
With the number of young people you mentioned have a history of domestic violence, do you find are case managers having to deal with maybe an unexpected amount of navigating those types of situations, or is it generally a history and not necessarily a current situation?
Generally a history and not a current situation. We do have some young people in current situations, but not 73%. It tends to be historical situations.
And is that perhaps being in a family where domestic violence was an issue, or is that them specifically experiencing that in a relationship or from a family member themselves?
So we don't specifically ask them to break down, where they experienced it, but based on the feedback I get from the case management team, I would say that it's a mix. It's a partner, previous family members when they were living at home. So yes, I would say it's a very big mix of partners and families. The majority who are experiencing it currently, it is partners, and not that they're fleeing their family.
It would be great to have a copy of the slides. Is that possible?
Yeah, I can send those to Hannah and I'm sure she can blast them out.
Thanks. Love to have them. Thanks. So any more questions for Carrie? No?
Well, and I'll make sure that Hannah, of course, has my email. So Hannah, when you blast out the slides, you can share my contact information. So if anyone does have any questions moving forward, I'm happy to talk anytime.
Thank you for the update. That was really helpful.
Thank you.
Thank you.
I want everyone to remember to be excited because this is something we all worked for and planned for a long time together. And it's happening. That's good.
It's definitely exciting and interesting that we're able to accommodate people being in Clarksville and Lebanon and places even further out than Nashville. That opens up a lot of possibilities, although I'm sure it also adds to time and logistics for the case management fees.
It definitely does. You know, so there is a limitation to how far we are able to still provide case management. We also factor in, does the community have a active COC of homeless services as well? Because we've had some young people who went to Kentucky and it was the same distance, but they had a very active continuum of homeless services. So we did exit them and connect them with resources there. When they moved, they were housed. They were housed when they moved to Kentucky, but just in case something happened, we connected them to resources there and did exit them, not provide continued case management at that point.
So I guess we should move on. Unless I sit here.
Thanks for having me.
Thank
Thank
you.
you, Carrie.
Appreciate the update. That was great. So Hannah, I guess the next we were going to kind of look at our goals and next steps. I know that you sent me some information that you had looked at from the strategic plan that you thought was relevant. Did you get a chance to go back? Do we have any reporting on the last exercise that we did as a group on goals?
Yes, let me pull that up.
Thanks. Some of you may remember that we sat in the conference room over at Metro Social Services and put Post-it notes on the wall. Does that sound familiar? Way back when? Okay.
Okay, so our goals that we had planned on then were we wanted to work towards a year-round emergency shelter for young adults, which I know has always been a huge goal that we've had. Continued financial support for the Youth Action Board, which I feel like we can say we've accomplished. As Susie mentioned, the Youth Action Board is now getting paid through the regular COC planning grant, which is a renewable annual grant, whereas before it was an expiring grant, so that's great.
Amen.
Yes. And expanded participation in HMIS and coordinated entry by providers, so more people putting in data so that we could actually continue to know how many young people we think are experiencing homelessness, as well as expanded housing resources for youth through coordinated entry. So I don't know that that's really one that you ever finish, but some updates on that are that we now have Launchpad participating in HMIS. We're finally able to open it up to new people joining, whereas I know before we were always waiting for that to be possible. Crossroads and Monroe Harding. So that is all exciting. That's more people who are able to put young people into coordinated entry and track regular data through HMIS. Like LaMorris mentioned, we have FISC Courts, which goes through coordinated entry now, as that's how young people get in. And we have all this new rapid rehousing. So there is progress being made, I think.
So we just have to figure out how to do year-round emergency shelter.
Yep, just that tiny goal.
Just that tiny little goal.
Yeah, I just want to back up and say, that's a lot of progress, especially for being slammed with the pandemic. Like, that's fantastic.
Yeah.
Yeah, it is. It really is. Well, and I guess looking forward, Hannah, what, thinking about the role this committee can play and trying to tie our work into the strategic plan for the COC, one of the things that you identified was revisiting the inventory of housing units and support services for our population in the community. We did that as part of putting together the YHDP grant and the coordinated community plan, but it would be interesting, I think, to try to revisit that. And I guess I'm thinking that's best done by some sort of a survey that we could send out through to committee members and have them send it out to the other partners and stuff they're working with. I don't know the most efficient way to identify all of the community partners that work in this space. I think we know most of them, but I'm sure there's others that are. And speaking of that, I guess identifying who might be working in this space who hasn't been a part of this committee and how we could engage them. Is anybody aware of any new? Somebody mentioned Step Up. They aren't working with this population, are they?
Not specifically. They're focused on chronic homelessness. So certainly, as we saw, some young people fall into that category, but it's not youth and young adult focused.
Okay. And then increasing housing referrals through this coordinated entry process. So it sounds like right now for youth and young adults, the most efficient way to do that is connecting people to the OASIS phone number that Carrie provided. Are there other in-town partners for CES for youth and young adults so that we're not putting it all to OASIS, or how does that work?
So anyone who's trained, we don't have like a one single access point. Obviously, we often send young people to Oasis Center because they operate the crisis line and they have a lot of people there who do it. But young people at Launchpad are now able to be entered. Monroe Harding has recently been trained so that they can enter young people at their hub. And then any like sort of outreach worker, like at Mental Health Co-op or Park Center, or anyone who's out in the community is also able to enter young people. But I think there has been some expansion of like youth specific people like Monroe Harding.
So those people are administering the youth Viaspadat or whatever it's called.
The Tay Viaspadat, yes.
Thank you. Okay.
At Launchpad, we have two new staff folks who just went through the training, like maybe Wednesday or Thursday. And I did it. Most of the folks that we get have come through Oasis, and so they're in coordinated entry. We don't always know which one. Some have had the intake done, but they haven't been entered in yet. I think they're getting a new data entry person at Oasis. I think Amanda told me that. But my hope is that when somebody presents to us who has not come through Oasis Center, because we do get calls independent of that we can go ahead and get them entered, because we've got a lot of downtime with folks available. And just kind of take some of that off of the Oasis Center. So, but no one's done it yet. In fact, I think on Wednesday, what we're going to do is grab a couple folks, and together we'll sort of go through the process and make sure we all understand it, see what questions we have. And then once we're good at it, because it's not the totally most intuitive program I've ever used, then we'll just continue entering folks as needed. And excited to do that, because we're trying to ask those questions anyway. I've hired people that, we went from having people who are shelter, I don't know, they're just overnight shelter staff and volunteer site directors, to two people that are caseworkers. And so as we get our program sort of established, and how are we running at this motel, and how are we getting these daily needs met, they are empowered, encouraged to innovate and look for other ways to help folks. And we, like a lot of times people need ID. Oasis does that, but now we can help with that as well. So it's a little bit confusing, because people have caseworkers and then they also have us, but we're just trying to find where can we plug in. And I'm hoping even in a while that we'll be able to do a little bit of diversion. If we get a call from somebody who is in housing but is about to lose it, we might be able to do some referrals there. So I'm pretty excited, and I really like the caseworkers that we have, Joby and Samantha Ray. I'm just very excited they're able to do what they're able to do. This was supposed to be the year that we really started thinking about the year-round youth shelter. So if we want to get into this sort of talk about that a little bit, the only thing I kind of wanted to say right now is I think it would be, we need the vision sort of first before we can sort of figure out, well, how much is going to cost us, and then figure out where we're going to get the money. And I think it would make sense to have the youth board sort of involved in helping us vision that, like what's it going to look, especially people who have lived experience. Although we have a youth board member on that is part of Launchpad who was not ever in a Launchpad shelter, but she's phenomenal. So she would be somebody I would want to include. So that'd be one thing I would ask the youth board, if they would, if somehow or another they would like to be involved or help us find people who might be involved. It's going to be a challenge, although I'm hoping as we hit the summer, enough vaccine might be out there that we can start meeting in person and feeling a little safer about doing that. It's not always easy for folks to, get access to Zoom. So, but we kind of stopped all of our thinking about how are we going to do this? Are we going to find a church we can stay at 7 days? Are we going to try to buy a building? Or is someone can we get Metro to donate a building? All those kinds of things. I think we should start thinking about now. And how this body sort of connects to that, I'm not really sure, other than it's an obvious place to be talking about it. So yeah, that's kind of where we are. And I think we're getting some good experience in the motel. It's a little weird because everybody's in their own room, and so they're kind of isolated. And I'm trying, our caseworkers will literally go to door and just, checking on people. There's not really a chance for people to get together and have any kind of community problem solving or anything like that, at least not in person. So it's a challenge, but it sort of gets us ready, I think, for the higher standard of what it means to do emergency shelter. I'm really not going to be happy if we're going back to people on a mattress on a floor who have to leave at 7 a.m. on a cold day with no particular place to go. So I don't want to go back to that. And so what's it going to look like next? And that's kind of what we're starting to think about, just now starting to get back to thinking about.
Hey, Ty, when you talk about the motel, you're paying for that Launchpad?
Yes, that's what we use the majority of the ESG CARES funding. We got other funding as well, but yeah, that's what we're using it for. It's not cheap, but the experience is pretty good.
And keep in mind that those folks, if they're in motels and their way is being paid by a nonprofit like yours, whether they're youth or families or chronic adults, those folks are considered homeless in HUD's mind. So the night of the count, those folks, we need to make sure that they're enumerated and included. If they their own way, unfortunately, for some reason, that HUD flips that to not being homeless. So anyway, so let's just make sure we keep tabs on those populations who are in the motel rooms and make sure that they're counted.
Yeah, every dime of the motel comes directly from us. So yeah, they should all qualify.
As for what you were saying about envisioning what a shelter could look like, I know that the Youth Action Board, they actually, again, before the pandemic themselves, were starting to have some conversations about that, so they would love to participate. And I know that the young person on your board, I believe, is the chair of the Youth Action Board. So we can, I'm sure, help discuss how that could be set up. And I can help her figure out whatever she needs.
Yeah, I would really like that. And once we get closer to that, might just advertise. The length of stay is longer in a motel than it might be in the shelter environment. So we might be able to find some folks who are actively staying with us right now. I have to think about people sort of be violating their own confidentiality, although they won't have to necessarily tell anybody they're currently staying with us. So there's kind of that issue, but and former Launchpad folks as well. So a bunch of folks living around Fisk, and there's at least a couple out at Mercury Courts that I think would be good. And I don't even know who's involved on it right now. So yeah, let's figure out a way to make that happen. And we can do, like, the first sessions can just be fun visioning, just be crazy. What would it look like? And from there we can start trying to make it real.
Well, and I'm wondering what role the committee can play in assisting in the thinking about that, and the making sure that what's being developed ties into other aspects of this continuum of care we're trying to create. I mean, it's is this solely something that Launchpad needs to be carrying the ball on, or is this something that the committee should participate in a supportive way and figure out? I think if thinking about funding down the road and that sort of thing, and having the opportunity to talk to funders, just looking if it's a collective collaborative process, I should say, that it might strengthen that case. So I don't know, what do other committee members think about the role that this committee should play in working toward year-round emergency shelter for our population? And then what's our, I think we've been saying 1,100 seek emergency shelter each year. Do we have an updated idea, perhaps from some of the work that's been going on the last year, about what that looks like? And I heard significant percentage of the young adults that have been housed through rapid rehousing were chronically homeless. Sounds like we've got some young people who've been outside for a while. So anyway, just curious how the rest of the committee feels, and Ty, obviously, how you feel about what that looks like from a committee perspective.
Hey, I just want to quickly say, I feel strongly that this committee's role should be saying what youth and young adults experiencing homelessness need, and be saying that regularly and often, and that is year-round shelter is a part of that in the context of everything else that they need. But I'm also so sorry, I only scheduled an hour for this meeting and I have to hop off. Ty, congratulations. I feel like the work of Launchpad is so important and has definitely filled a gap, and yeah, good work on the hotel stuff. That's amazing. I'm hoping that COVID will really help show people that this is a better, humane way to do shelter if we're in pandemic or not. But are we going to be meeting monthly now, Hannah?
Yes, not necessarily at this time, I guess, but I think we should all try to plan to continue to meet now that we finally got started again.
Yes, perfect. I look forward to the next meeting, and if there are action steps after this, I would definitely love to see them and plug into them. And good to see everyone, and I hope to see everyone soon.
Thanks, Michelle. Well, I think we're going to wrap up pretty soon, but we'll let you know what else happens. So I guess
Hi, Michelle.
I guess I do feel like that, again, there's the Launchpad program, and envisioning that by Launchpad makes sense, but that trying to create shelter opportunities or figure out how we do something that's not exactly shelter but meets those immediate needs when you've got young people waiting some period of time to get into housing once they're identified. I feel like the committee should have a role in that. And I'm wondering if there's, maybe a subgroup of people on the committee rather than the whole committee trying to figure it out might make sense. And I don't know if we're getting ready to bring on any new members. If we have other people who are going to come to the table. I don't know who's at the table now who's interested in, kind of helping this committee continuing to raise awareness in the community about the need and quantifying the need and all of that. What's your thoughts?
I mean, I think it would be good to have the committee support behind Launchpad as they create their vision, and having all of these organizations sort of being able to provide whatever expertise everyone can, and the connections to all these other services that everyone else is providing too. So when Launchpad's, making their case for why we need these things so we can have year-round shelter, they can say, Crossroads can provide this job training program for young people staying in our shelter if that's something they want. Oasis Center, make sure they're connected to these things to sort of show that we have that whole network of support for young people. So it's not just year-round shelter, but the shelter is like a part of a whole system that's going to lift up the young people, not just a place to sleep at night.
So are we looking to Launchpad to be the solution for shelter for young youth and young adults for the entire community? I think that's part of what I'm trying to. Right now, they have the capacity to take 20. We either have to help them grow their capacity or we have to figure out what else.
This is a dumb question. I'm just going to repeat what Lisa said about dumb questions. But Oasis Center has a really big building over there. And I thought they used to have like emergency shelter beds, like 7 of them. And I'm just wondering what their space is all used for over there, and why Launchpad would have to be then saddled with purchasing a building, leasing a building, heating a building, and resources are kind of scarce out there. But
Oasis Center has emergency shelter for minors. So they do have like 12 beds for that. That might be what you're thinking of. Okay. And that's like a whole section of their building for that.
And I kind of like the way the space is designed. People have individual rooms there, but there's communal space. So that's definitely something we would look at as far as design. But actually, it's really hard to say in reality because of COVID, but I think Oasis is trying to even sort of back a little bit out of the outreach part and focus more on the rapid rehousing part. And so part of our vision is that wherever we are, no, Lisa, I don't think it has to be just us. I mean, I think that there's a need to be met. So where is Launchpad going to go? Maybe Launchpad ends up doing more of a transitional housing, focusing on LGBTQ youth because there's something else that opens up that is more the emergency shelter model. I don't know. I don't think it. I think it would almost look like a conflict of interest if we just said Oasis, Launchpad is going to be it. So we're not, but obviously we're going to play a role. So I think we identify what the specific need is. We look at visions and also models that already exist, that are already out there, which I've started doing to get ideas. And then, definitely figure out, well, which part of this is Launchpad's piece and which part of it maybe belongs to some other organization expanding or some new organization coming along. It's a lot. Remember, Launchpad we were like 2 years ago, we were like a $70,000, $100,000 a year organization. Our only paid staff members were people who stayed overnight. So this is new to us. And, honestly, just getting help with the more bureaucratic, like this whole ESG COVID grant, that's new to us. That level of bureaucracy, there's a certain amount of, I feel like, hey, we expect you to kind of already know a little bit about how this works, because I find terminology going back and forth that I don't always know. So, so that kind of technical consulting would be really, really helpful. You really should be eligible for this and this and this, and here's how you do these things. And then identifying the very specific gaps in for youth right now. So if we say year-round shelter, well, we've got 5 months of that in our current model. What are we really saying the gaps are that need to be met? What does Oasis do, and what is Oasis going to do in the coming years, and what are they not going to do? Who else is going to be able to take some of that up? Are there organizations that are not specifically youth related that still meet those needs? Although our sort of philosophy, and I think the data sort of shows, having separate segregated youth shelter, you get better outcomes. Does Launchpad need to focus just on LGBTQ youth? That's always a tension that we have. It's not a real negative thing, but we really do try to focus on the LGBTQ population, but we also get people who just present to us. And if we're full of folks and not as many are in the LGBTQ population that we're serving currently as we know are represented in the population, that's always like, well, how do we fix that? Right now, since we're on a waiting list, I'm just people who are LGBTQ, particularly people who are trans, we're kind of elevating them on the list because we find that they're less safe on the streets than other folks, all other things being equal. So no, it doesn't have to be just Launchpad. Let's identify the gaps. Maybe we've also got folks that, I was very intrigued by what Carrie said. What's going on in Kentucky? Why do they have more services available than in Nashville? What does that look like? What did she mean by those? I didn't want to take up the conversation with that, but what does she mean by that? What can we learn from them? I can do a road trip to Kentucky even under COVID. So anyway, those are the kinds of things that I think we could do. I don't know specifically step-by-step action plan how to do it in this committee, but that's kind of what it's like in my head.
Well, and
Yeah, and I wasn't suggesting that.
Okay.
I wasn't suggesting that it all go to Launchpad, but I do think we need to, say 1100, going back to Lisa's citing the modeling exercise that the technical assistance folks spent a lot of time with this community kind of doing. So you take 1100 and divide it by 12. I'm just doing a really simple calculation. And then you got, I don't know, 90 a month. And you got 12 beds over Oasis Center for those who are minors. Are they always full? I don't know what the utilization rate tends to be. If they're not, then it's kind of a hard sell to sort of say what's needed when their emergency shelter beds are at 80% typically. That we need to kind of do a little bit of a deeper dive to see where the gaps are before sort of going on. But fundraising and to create something that I think we just need to look into a little bit more.
And I think that's the point I'm trying to make is it feels like, yes, I mean, kudos to Launchpad for what they're doing. And as part of what I'd like this committee to do is to support those efforts because they're very important. But I'm not sure it's fair to say, well, Launchpad's got this, we'll have their back, because I think we need to go back to the model we're trying to create for the city and figure out what is our vision for what emergency shelter looks like. And how does that tie into this bigger model? And then Launchpad's got this piece. Where are those gaps? That's the part I feel like this committee could play a role in, and maybe again not take up the entire committee's time, but I think there could be a subcommittee of people who do some research and do some. I just feel like that is an area where I'm not saying that there's not a lot of other unmet needs for our population, but that feels like one that we, with the exception of all the work and good stuff that Launchpad is doing, that we as a community haven't really addressed.
All of this discussion of gaps makes it sound like that inventory step on the strategic plan would be a great thing to work on moving forward, because that's how we're going to find the gaps, figuring out what we have. In sort of looking at, that's it.
So I think we ought to expand that inventory to include shelter, because right now it's focused on housing units and support services. So I agree. I think so. So maybe this falls under that initiative.
What I can say is that there's a big gap that you guys are not looking there, because if you're only focusing about Oasis Center, housing, and you're talking about minor people, what about other organizations as Park Center or Morrow Harding? Like Morrow Harding has housing with got like independent group homes that I used to be there, and they're amazing. And also they got also with minors also. On top of that, Park Center also they got the same thing, and both sides they have empty spaces that you can fill in with people right now. Because where I stay in the girls' house with Park Center, and they help with a lot of things around. Like I only been there for a month in Park Center, and they got me in my own apartment.
That's fantastic. I think a lot of the data we might need about it may already be there, like the 1100 number, and that was specifically young adults. That wasn't counting, I don't think, minors. That came from Oasis, and I looked at that sort of study with interest. I don't know if I can tell from looking at the data how many of those folks are homeless for just a few days and access the mission maybe one time, and then we're able to move in with a different relative or friend? And how many of those are folks that are more chronically homeless? And those are different needs. But I do think that trying to do a dive into what we know, and even the HUD guidelines say that segregated youth housing, especially LGBTQ affirming youth housing, since we know that about 40% of youth who are experiencing homelessness are part of the LGBTQ population, is important. We don't want our young people staying at the mission. And we can have a larger discussion based on that, but every single young person that comes to us who's been at the mission has had a horrible experience there. And because they're younger, more easily exploited, especially if they're LGBTQ, it's not safe. So we don't want to play that game that often happens in the city. Oh, there are beds here, therefore the need is met. We know that is not, it's not as simple as that. So I don't know if maybe a first step for this committee or a subcommittee of this committee would be to, how do we really identify what it is we're saying is missing? I know that what we're doing, I have a waiting list, and I have been to I've been like now telling all the caseworkers after the first day, we opened up saying, hey, you can refer people, but at this point there's 10 people on the waiting list, and so I'm not even really getting that many referrals anymore. I think if I just said, yeah, everybody send me everybody, I would have at least 20, 30 people on the waiting list. There's clearly a need. So, and maybe it's not that important even to say, well, what is Launchpad's specific role right now, as it is to identify what is the needs that we're saying need to be met for this population. Rapid rehousing is excellent. I hope it continues past when the grant runs out, like she's saying, because without that piece, the rest of it doesn't really work. But I think that would make a good first step, is let's figure out, let's dive into the data and really figure out, and I don't know how to do this, what the gaps are. And so we can make that case really compelling. I know it anecdotally because I know how many people we see, and we don't see everyone. We see 125, we saw 125 individuals last year, but that was just in a shelter environment. And a lot of people would rather sleep on a couch than come sleep on a floor in a church. So that does not hit everybody. We also know that young people are more likely to be couch hopping. So we may have it's a little bit harder to figure out how many are out there. And yeah, they're not really in safe, stable housing, but they're not staying in the shelters. And I think Oasis's data might get at some of that. So anyway, that would be my suggestion, is how do we go forward figuring out what are the specific gaps? And we'll figure out where Launchpad plugs in, and we'll figure out ways to meet those other gaps that Launchpad is not meeting as well.
Figure out what's an emergency shelter need and what other ways we can serve those young people. It may not be an emergency shelter situation. It may be something in between that and the permanent housing that Rapid Rehousing will fund. And I've lost track of the details of the modeling that we did. It would be worth revisiting that at some point to see where, because we were focused obviously on things that HUD would fund, like housing, not shelter. But I think we did, we should have some numbers about how many beds the city should have for youth and young adults per shelter. I think that should have come out of some of the modeling that the technical assistants did with us, correct?
Yeah, that's definitely in the modeling.
So, I mean, that might be a starting place. And, I think it's a given that the need outweighs the inventory right now. And yes, there might be a spare bed somewhere, but having that bed staffed is the issue. It's not always physical space. It's also services and staffing for beds. So while some of the agencies that have beds might have some free right now, I don't know that it's fair to say, well, that should just become our emergency shelter. It doesn't necessarily flow. So anyway, that's enough of our time on that. But I would like to propose that this committee form a subcommittee to focus on keeping the shelter, year-round shelter need, and let's just say the sheltering need, and just year-round, yes, but sheltering for this population and what that future looks like. And I think, that could be a smaller group of people, and we ought to let people self-select maybe to participate in those conversations. And I guess, again, the question, I know that right now people are signing up for membership. Susie, are we going to be getting new members? Do we know yet?
What we've done at this point is just sent out general membership forms and not asked people to sign up for committees yet, but we'll be doing a committee interest form that goes out in either January or February, so that folks can look at that committee list and see which one they'd like to participate on. And then we would throw those names and their qualifications to you and staff as sort of the experts about what you might need to add if you've got enough members, et cetera.
Thank you. So, and I guess going back, we're looking at the list of things that we could move forward with. Obviously, the inventory, revisiting the inventory for housing units and support services. And I guess, Hannah, I might want to brainstorm with you offline about what the most efficient way to access that data is. Obviously, we can pull all the COC, all the agencies involved in the COC, and that might be the logical starting point. But is there another efficient way to connect and to identify everybody in this, serving this population at this moment in time?
I mean, we can look at the COC, and then sort of like a guide, I think, to services was made several years ago when the YHV planning got started. So we could also reference that and like check in on all those things. I think that would probably give us some decent cover.
Okay. That sounds
When
like a good
Oasis
starting
did this, when Oasis did the study, I think it was Mark who ran it. I doubt he's going to have any time since he's taken over as CEO at Oasis. But he must have had other people who helped with that data. They basically picked, it was like only about 4 agencies, I think, where they gathered data of who accessed your services, who were 18 to 24. And then they went through the process of trying to make sure they didn't, have 2 John Smiths that turned out to be the same person, the deduplicating. But it was just, I think it was just like Rooming In, us, the Mission, I can't remember if Safe Haven, there were just a few listed on there, and that's how they got those numbers. I don't know if there's more data to be mined there. If we could tease out of the raw data, how many of these folks were just homeless for a few days, as opposed to people who needed services to support them longer. But I don't know who else was involved in that. I'd be interested. Maybe we can find out.
I know that Michael did all that data with the numbers, so maybe he'd be willing to talk to us about it. I believe it was an extensive process.
Michael Senti?
Yeah, Michael Senti.
Well, he's in Detroit now, so
he might be willing to talk to us, but he won't do it again.
Yeah. Okay.
Well, and I think they looked far and wide. I think juvenile justice data were in there. I don't think it was, it may have been different things they were looking at. They were reaching out to different agencies, but we could certainly check in with him, and he maybe could point us in the right direction. There's also a data committee for the COC, so there may be a reason to have a conversation with them, Hannah. What do you think?
I mean, we could think about it. There is some level of, they have a lot of tasks in the strategic plan I know that they're working on.
Okay.
Data that's in coordinated entry and HMIS, I'm actually pretty good at pulling reports and building those. So I could find out. I feel comfortable getting stuff that's in HMIS and coordinated entry.
Okay.
There would just always be an added caveat of here are the things that I know that aren't in here, which is the mission.
Gotcha.
Rooming has actually started entering though, which is great.
Great.
And I would say the data committee has its plate full and would probably, if it came to trying to identify unmet need and gaps in youth and young adults, they'd look your way.
That makes sense. That makes sense.
It's going to come back around. And
I just was trying to find somebody else who had access to the data. I don't have access to the data, so that's my excuse anyway. Well, I guess part of my point is whether it's 1,100 and whether out of those 1,100, 50% are, 30% are chronically homeless. I think there's still an opportunity to look at the model the city's trying to create and figure out, what do we call emergency shelter? What do we call transitional housing? What are the gaps between identifying someone as homeless and them getting into the rapid rehousing program, and how do we take care of them and keep them safe in the meantime? or for those people who aren't going to qualify or be high enough on the CES to ever get into housing through that process. And that's a reality. You know, I think there's enough need to warrant some looking at what kind of system we want to set up while we're figuring out what the numbers are that go into each part of the system. Does that make sense? If we could get bogged down in data and not actually move anything forward, would be my concern. So yes, let's mine the data some more, but I think it's obvious that there's a need beyond what we can currently serve, based on at least the anecdotal 125 individuals at Launchpad last year, people on a waiting list, and a waiting list that would probably be longer, and that's, you know.
And the purpose of the VI SPDAT, if we said it honestly, is rationing. We only have the capacity to get a certain number of people into housing. So the VI SPDAT is trying to figure out which of those people are we going to pick. So sort of by definition, it means the rest are not going to get picked. And we hope that housing navigators, you know, because like I said, a lot of our folks are working right now. So even though they're not in rapid rehousing, with some coaching, maybe they should hopefully be able to get in housing. But it's hard. You've got to have the, you know, you've got to have the right background. You've got to have the 2 months for the deposit and things like that. And we don't have the ability to give that to them. You know, maybe that's maybe there's another thing that's under rapid rehousing. That's what I call the low hanging fruit, like those folks that, so the VI SPDAT wants to take the people who are the most vulnerable. So there's a lot of folks that we see that just need a tiny bit of help and they'll be back on their feet. I hate to say it so glibly, that is not true, but you know, so the low hanging fruit, I would love to find a way to get them into housing quickly, for example, just for example.
I just looked at the clock and realized we're 2 minutes over time, and I don't want to. Hannah, is there anything else that you need to address with the group before we sign off?
I'm excited we met again. Look for an email from me about a regularly scheduled meeting. And I'm sure Lisa and I will talk and put all this conversation into a cohesive plan for the future.
Absolutely. No doubt about it. Thanks, guys. Any questions or anything else you want to add before we sign off? Thanks for all your time this morning, and we'll, you know, be good to get this moving again. Looking forward to working with everybody. Take care.
All right. See you guys. Be careful.
Good to see everybody.
Thanks.
Bye, everybody.
Bye.
Hey,